Gerald Griggs, a justice fighter, here for your coronavirus update for today. And the numbers are out from the Department of Public Health. And again, the numbers have jumped again, especially in the number of deaths. So yesterday, there seemed to have been a little bit of a snafu around 7 o'clock with the numbers as we saw the numbers go down. So I reached out to the Georgia Department of Emergency Management, and they confirmed that the numbers were were not accurate. So now we have the accurate numbers. So I want to give you the numbers from yesterday and then show you how the numbers for today have jumped. So yesterday, the numbers were 18,489 cases. There were 3,489 hospitalizations and 689 deaths yesterday when they finally updated the correct numbers for 7 o'clock, and they put those out at around 8:30, 8:45. Well, today they released the numbers for today, and this is April the 20th at 11:27, and the numbers are as follows. We now have 18,947 confirmed cases, so that's up almost 500 cases. We have now 3,550 people that are hospitalized, so that's up almost 100 cases, more like 70 cases. And now we have 733 deaths, which again, there was 689. Now there's 733. So as you can see, we're still going up the curve. We're still rising. And at this point, there seems to be no flattening of the curve. So I do understand the governor's going to have a press conference at 4 o'clock where he's going to try to outline steps to reopen the state. And my response to that would be, how about we flatten the curve first, and then we can start talking about opening the government and opening the economy. So as far as counties are concerned, Fulton County now has 1,274 cases and 78 deaths. DeKalb County has 1,508 cases and 25 deaths. Dougherty County, 1,436 cases and 97 deaths. Cobb County, 1,174 cases and 54 deaths. Gwinnett County, 1,164 cases and 42 deaths. Hall County, 649 cases and 9 deaths. Clayton County, 535 cases and 18 deaths. Henry County, 380 cases and 8 deaths. Sumter County, 332 cases and 16 deaths. Cherokee County, 312 and 8 deaths. Carroll County, 282 and 9 deaths. Lee County, 273 and 16 deaths. Richmond County, 273 and 10 deaths. Bartow County, 250 and 22 deaths. Douglas County, 239 cases and 6 deaths. Muskogee, 228 cases and 4 deaths. Mitchell County, 206 and 23 deaths. Forsyth, 205 and 7 deaths. Bibb County, 204 and 1 death. And then the rest of the counties, about 15 counties, have well over 100. And then about 40 counties have between 100 and 10. And then the rest of the counties have at least 1 case. There are 266 cases that are unaccounted for by county. And then there are 941 cases and 7 deaths that are non-Georgia residents. So that's important to know. And then the numbers of tests, and this is the most important thing, and I think this is what people miss the most. Georgia has currently tested 78,966 at the commercial lab and 5,362 at the Georgia Public Health Laboratory. So that's a total of 82,000 people. So 82,000 people that they've tested, and we got 18,000 infections. And again, to get a test, you got to have a referral and have active symptoms. And a majority of the people that are infected that are not being tested are asymptomatic. And so when you understand that we got a lot of asymptomatic people walking around in the state of Georgia and we're not testing them, that's going to be real impactful should we reopen and see a second wave. China is seeing a second wave. There's other Asian countries that are seeing a second wave of this, and we have not been sheltered in place in Georgia long enough to flatten this curve by the numbers. And again, I'm only going to bring you the numbers. There's an actual graph on this website that shows from the first coronavirus case that we had which was February the 1st to now, and it's not flattening. It's continuing to go up. So we need to make sure we understand now the deaths are flattening and spiking and flattening again. But as far as the number of cases, it continues to go up. And so I understand there's a model now that said we passed the peak. I would love to see that model because the numbers aren't showing that. The most affected age group is 18 to 59. It's at 62%. And then 60 plus is at 34%. The most affected sex is female, which is at 54% female, and then 44% male. And then they break down the deaths. And I would love for them to put back on the breakdown of the ethnicity, the actual pie chart, so you can see in real time. But currently, there are 5,000 African Americans who had the coronavirus or currently have it, and then there's 379, 400 deaths. So of the 700 deaths, 400 of them are African Americans. So we really need to get control of this virus. They break down the deaths by county and by underlying condition and age. And again, mostly the ages are between the age of 30 and 70, but we have people as young as in their 20s and as old as 98. And so we need to really get control over what's happening in this state, according to the Department of Public Health's website as of 11/27. And so, again, Georgia has seen another rise in the number of cases of coronavirus. Let's talk about the state. And these are numbers from CNN, and I also have the CDC's numbers, which I want to go over with you. So currently in the world, there are 4.424 million coronavirus cases, and there have been 166,256 deaths. The United States, as of an hour ago, as reported by CNN, which gets their numbers from Johns Hopkins, there are 760,570 cases and 40,702 deaths in the United States from coronavirus. So again, we got 40,000 Americans that have died. We have 706,000 that are infected. And we're talking about reopening the country. Again, there are hotspots that are breaking out all over the country in smaller towns now. New York, the governor said they've reached their plateau. He didn't say they reached the peak. He said they reached the plateau and it started to go kind of like this. And so now you have Detroit, you got Philadelphia, you got Washington, D.C., of course, you got Albany, you got Atlanta, you got New Orleans, you got all of these smaller towns, Los Angeles, that are smaller than New York, but are seeing serious issues with coronavirus. And then you got the protesters out there who are protesting the stay-at-home orders, not understanding that this virus moves. And so when you go to the state capital, many of the state capitals are in very densely populated areas. You're going to take that virus back. So we'll see what the numbers look like in 14 days in many of these areas. But here's what I want you to understand. And I printed out the number of the population size in DeKalb and Fulton County just to give you an understanding of the resources. So in Fulton, they have 3,800 staffed beds. They have 4,600 licensed beds. So they got 4,600 beds. They got 3,800 that are staffed. And they got 656 ICU beds. But currently, Fulton County has confirmed cases. They have 2,174. So they got way more cases than they got ICU beds. So if the infections become serious, the ICU beds will be overrun. They do have enough staff beds for the coronavirus cases, but you have to remember those staff beds have to also take care of all the other sick cases that have nothing to do with coronavirus. So you need to understand that. And then they have 78 deaths. When this was printed out from Johns Hopkins, they had 75 deaths. So again, these numbers continue to go up. And that's for one of the most populated counties. Fulton County has a total population of 1 million in Fulton County. DeKalb County has a total population of 756,000 people. 756,000 people in DeKalb County. They have 1,900 staff beds and 2,300 licensed beds. So 2,300 licensed beds. We got how many beds, hospital beds they have in the county? 1,900 of them are staff. They have 307 ICU beds. DeKalb County has 1,508 confirmed coronavirus cases. So they're almost at the peak of the number of staff beds if all these people were in the hospital, which we know they're not. And then they have 307 ICU beds. So if all of them got seriously ill at the same time, the hospital would be overrun. So we need to make sure we understand in real time the number of resources that we have to fight this pandemic. And again, the CDC's numbers, and the CDC released these numbers as of April the 7th, but it started to collect the racial data. So the CDC, as of April the 7th, was reporting that there were 497,000 coronavirus cases. Of course, we know it's more than that, but that's what the CDC was reporting. 376,000 of them were not race specific. So they didn't even keep racial statistics of 2/3 of the numbers. But the 1/3 that they did keep was 120,000. And of the 120,000, 30% of them were African American. So 36,000 African Americans of the 120,000 that the CDC kept numbers on. So imagine if that broke out into the 376,000 that they didn't keep racial numbers on. The point is this virus is disproportionately affecting African Americans. And we have to make sure that we know this. Georgia, the Georgia cases, 4,916 African American cases of COVID-19 in the state. But 362 of the deaths are African American. And then, just like the Centers for Disease Control, 8,860 did not collect the racial data. So again, we already know that between 30 to 40% of this is African American. There's no reason to not, one, be sheltering in place unless you're an essential worker. If you're an essential worker, please get you an N95 mask. Please get your gloves. Please keep sanitation. Keep your make sure that you have the sanitary wipes, and you make sure that you wash your hands and you abide by all of the Centers for Disease Control's guidelines, because this is real. I just did an interview with Streets 945, and there were some comments below that were talking about, they still don't believe this. I'm just asking you to go to the website yourself. You can go to the Center for Disease Control's website, cdc.gov. You could go to the Johns Hopkins website, coronavirus.jhedu for yourself, and you can go to the Georgia Public Health Labs, Public Health Department's website. That's dphgeorgia.gov, and you can see the numbers for yourself. And the numbers continue to disproportionately show that we're not responding to this appropriately. And so I'm going to continue to give you the updates. Let me go through a couple of the comments here to see if you guys have any questions. Yeah, mostly yes. Thank you for listening, and thank you guys for sharing. But we have to get this information out in real time, because members of our government are not giving us all the information. And hopefully it's just an oversight. Hopefully they're overwhelmed with the numbers and they can't get them out on time. But we need to be guided by the data, not by their hopes and aspirations or their opinions or any of that, because the data is continuing to show that we are going up the curve. And we have examples from countries all around the world of what happens when you respond appropriately, like Taiwan, who locked everything down, who tested at a mass scale, did trace testing, did diagnostic testing, passed out an N92 mask. And then you have countries like Sweden who just let the virus take its course. You have, Germany is now releasing some of their lockdown, but the Prime Minister Angela Merkel said that if they see a flare up, they're going to lock it back down. And meanwhile, our president is telling the states, that they got to do all the testing and we got enough tests, when his vice president went on Meet the Press yesterday and said we have 5 million tests. 5 million. They've tested 3.4 million and they have 5 million more tests. So that's 8.4 million tests. This country is 330 million people. Do the math for yourself. If we only have capacity for 8.4 million tests and we reopen, not knowing where the virus is, not really doing our trace testing, because the governors keep saying that they don't have the resources, we're going to have a real bad problem.